Hi, how are you doing today, Amy? My name is Danny. I'll be your student nurse. We're going to be doing some vaccines today. Can you please state your name and date of birth? Amy Brown, 325. I'm sorry, 325-33. Alright, sounds good. So do you have any allergic reactions to vaccines that you know about? Any allergic reactions at all? No, okay. At this time, I'll be assessing my patient's muscle and circulation and weight and everything like that. I'm going to feel the acromion process and then her deltoid muscle, and it feels good. That'll be a good spot for my flu vaccine. And then I'm going to look at her arm for her tuberculin test, and that looks like it's a good spot as well. Alright, Amy, I'm going to go out and I'm going to go to the med room and get your vaccines ready. Is there anything you need before I leave? Alright, so I'm going to go to the med room. Hand hygiene. So my first check, I checked that her name was Amy Brown and her date of birth, and I asked her about that. I'm going to check her medications to make sure that they match for her 6 rights. The first one I'm going to check is her flu vaccine. It's the influenza vaccine, 0.5 milliliters intramuscular 1 time at 9 o'clock. And it's influenza vaccine, 0.5 milliliters intramuscular. It's not expired, it's not broken, nothing's wrong with that. The second one I'm going to check is the tuberculin, and it needs 0.1 milliliters 1 time a day intradermal at 9 o'clock. And then the tuberculin, it is 0.1 milliliters. It's not expired, it's not open. That's what she needs. So now I'm going to start to get them ready. Oh, also our vial that we're going to draw out of, it's not expired, it's not broken, there's nothing wrong with it. So I did hand hygiene. So the first thing I'm going to do is the vial. I'm going to use this gauze. I'm going to take it. I'm going to break away from me so it doesn't get on me. Set that down. Put in the sharps container. Next, I'll grab my needle. I'm going to need to put on the filtered needle first. I'm not going to touch the needle part, so I'm just going to unscrew it here. I'm going to take this, screw that in the sharps container, put that on, take this out. For this, I'm going to try not to touch the outside rim. Not getting any air bubbles in. And for the last part, I'm just going to tip it sideways so I try to get it all in there. I'm going to put this in the sharps container. I'm going to put this back on here, not touching it. I'm going to take this off. Put it in the sharps container. And then I'm going to replace my needle tip. Then I'll make sure that there's no bubbles in it. No liquids coming out, so I don't need to use a proper disposal. It's perfect right at 2 milliliters. I'm just going to put this back on. And then for that, I'm going to properly label it. Put this in the trash. I'm going to try to keep it above my mark so I know when I have to push it in and take it out that I still have the right amount. And I'm going to set this into my sterile area. Next, I'm going to be mixing my influenza vaccine. And for that, I'll be taking out 3 milliliters of this and putting 3 milliliters into there. I'm gonna have to pop these caps off. I'm gonna be cleaning the tops of them off to make sure that they're sterile. Next, I'll be grabbing my needle for this, and I know that the influenza vaccine is intramuscular, so after this I'll be changing to my 1.5-inch needle. I'm sorry. Yeah, my 1.5-inch needle. Grab this. I'm going to pull this back to make sure it's not in the way. Take this off. And since I know I need it, this calls for 3 milliliters, I'm going to take my 3 milliliters of air. I'm going to put it in here, making sure that my air doesn't go into the water so it doesn't make any bubbles. And flipping it over. And it fills on its own because it's pressurized in there. I'm going to do my best not to have any air bubbles. Looks like I got a few. So I'm going to go just above 3, and then that'll account for the air. I'm going to get my air out. Just to get the air bubbles out. And it looks perfect just at 3. And then I'm going to insert it into my powder. With the powder, I'm going to move it around in my hand, making sure not to shake it so I don't create any bubbles. This takes just a second. Alright, there's no more sediment in the bottom. It looks good. So what I'm going to do, my vaccine calls for 0.5 milliliters. So I'm going to pull out 0.5 milliliters. I'm going to stick it in there. Insert the air. Flip it over. Pull out my 0.5. And get all the air bubbles out. And so before I push the air back through, I'm going to put on my new needle tip so all the medicine goes into the actual needle that it needs to be in. All my packages weren't open, they weren't damaged. This will go into the sharps container. There's my new needle. I'm going to label it for my influenza vaccine. There's no air bubbles. It's perfect at 0.15. Checking again to make sure that she needs the influenza, 5 milliliter. Intramuscular, we got the proper needle tip, it's 5 milliliter. Also, with that, we're good. Checked it twice. Next, we're going to do our tuberculin test. I'm going to clean off the top of this, pop that cap off, clean off the top. It's not broken or anything, so that's good. For the TB needle, it's a 5/8. It just goes right underneath the skin. I need, it says 0.1 milliliters. 0.1 milliliters. Put that in. Put the air. There's no air bubbles. It looks good. I'm going to label my needle. Just one more check to make sure before I go back in the room that all of her 6 rights are covered. I have my TB, 0.1 milliliters intradermal, 1 time at 9 o'clock. We're good, it's proper time. I have the influenza vaccine, 0.5 milliliters intramuscular, 1 time, 9 o'clock. And then I have my distilled water from my vial. So now we're going to move into the patient's room. Hi Amy, I'm back with your vaccines. How are you doing? That's good to hear that you're doing good. So they got these prepared for you. When they go on your arm, they're gonna have a little bit of a sting. Just one more time, do you remember any more allergic reactions that you've had? No? Okay. So do you know what your TB test is for? No? Alright, so the test is just gonna put a little bit of bubble under your skin, and then you'll come back in 48 to 72 hours, and then we'll see if it had a reaction. If it didn't, you'll be tested negative for TB. We'll put a little circle around that to make sure that it didn't grow at all. And then your influenza vaccine, so you don't get the flu. That one's gonna hurt a little bit. It's gotta go down into your muscle. Are you ready? Okay, she's ready. So for demonstration purposes, we're gonna be using this for both the TB and intramuscular. My gloves will be put on last. So for the deltoid, I palpated, I checked this is the right spot, but we're just going to be using this. Alright Amy, can you please state your name and date of birth one more time? Amy Brown, 3/25/1933. Sounds good, thank you Amy. So first we'll do your influenza shot, okay? Again, I made sure it's the right vaccine, it goes in the right spot, it's the correct needle, correct amount. Alright, so Amy, that's going to give it a little sting, okay? Make sure to turn away from the patient. Put this into the syrup container. I'm going to hold it like a dart. Alright, I'm going to pinch right here, 2 inches away. Are you ready? 1, 2. Pull out just a little bit to make sure there's no blood, and there wasn't. Hold it for 10 seconds. Alright. Put this in the sharps container. So I would have done first is clean the area off in a circular motion, inward to outward. And then right after I had taken the needle out, I would have went right over with my non-dominant hand and washed it off. I would tell her that she can rub it a little bit to make it feel better, because it's going to sting for a little bit, Amy. Next, we're going to move to the tuberculin test. For demonstration purposes, I'm going to put it on the table because I would have her hold her arm out like this. You're doing a great job, Amy. How does your arm feel? It's a little bit sore? Yeah. Alright, so I'm gonna wipe inner to outer. There's nothing wrong with her skin, it looks fine. I initialed off that she got her vaccine. This is the proper vaccine, proper time, right patient, no air bubbles. Alright, Amy, I'm just going to pull your skin back, put this right underneath your skin, and it's going to be a little bit of sting, and we're going to hold it in there for a little bit, okay? So I'm going to pull back with one hand. Make sure the area is dry. Put it at a 15-degree angle. Alright. It held. It's a perfect little bubble.
Did that good bubble.
And then to make sure that I dispose of my needle properly, I'm not going to touch it. Put it in like that. Alright, Amy, looks like you got all your medicines. You're doing good. I'm going to wait with you. We're going to stay here to make sure that you don't have any allergic reactions. Are you feeling itchy at all? Is it warm? It's not warm. It's not itchy. About 30 minutes to make sure that you're going to do okay. And then we'll be done for the day. Do you need anything else before I leave, Amy? No, you're doing good? Alright, I'm going to check off that she got her TB. You did a great job today, Amy. She has no allergic reactions. I would tell the doctor about that. I told her she did a great job. She didn't squirm. She didn't do anything like that. And then make sure that the documentation is done. And that would be it.